compensated for their time by him before we talk. But with that being said, I got one other thing. We have an evaluation form for the program, so I'm going to pass these around towards the end of the program. And I know you just filled in the sign-in sheet, but if you could just take a minute and just let us know how you feel about the program, what you like about it, maybe what you didn't like about it. It's just a real simple form to fill out. And I'm going to turn it over to Dr. Brew and Clint. Thank you very much.
Thank you very much, Mike. Excellent. How are you? Pleasure to meet you. Okay, so what are we going to cover in this program? So first, we're going to talk about our Spark Ambassador, Clint. He's going to share a little bit about his journey with Parkinson's. We're going to talk about what is levodopa and how does it work to reduce off time. What is RYTARY, which is a type of levodopa, and how does that work differently than the medication you probably are aware of? And overall, how to live well with Parkinson's. I think those are four very good topics to be able to understand how things are, where things stand with Parkinson's, what therapeutics we have, and how to manage Parkinson's symptoms. So my introduction, of course, Mike did a beautiful job introducing me. I am a movement disorder specialist in Washington, D.C. I run 100% movement disorders clinic, so we see patients in all types of Parkinson's, from all stages of Parkinson's, from early to late stages as well. And so, me, of course, let's talk a little bit about Clint, our Spark Ambassador. Please give us a little bit of information about yourself.
Oh, hey everybody, my name is Clint. I'm just happy I could make the trip here today. This is normally where I introduce my beautiful wife. She's the extrovert, does all the talking, but she had to work in Boston today, so I put on my big boy pants and I'm going to try to get through this. We got married in 2013. She inherited my 2 boys and 2 daughter-in-laws and 4 grandchildren. And she likes to travel, so now I travel. She likes to hike and yoga and canoe and what else does she do? All those things, but now I do them, so I'm getting used to it. I had been an air conditioning contractor for 25 years in Phoenix, and I had to sell the business, and I transitioned from that to things like this, speaking to other people with Parkinson's, trying to encourage them and just let them know that you can. This is not an end thing. This is just the beginning of a new journey, and we can get through it together. Tana, my wife, has supported me really been very supportive through this whole process, and I try to give her the same support. She is a clinical specialist for medical devices. She travels all the time, and she refers to me as her personal Uber driver. Let's see, what else would you want to know about this stuff? We travel quite a bit. We've been, everybody's been to, a lot of people have been to Hawaii, so we've been to Hawaii, been to Mexico, been to Spain. We did the El Camino walk in Spain. That was quite a deal. And I did that after I got Parkinson's, so it was quite a hike. I'm fortunate I found somebody like her who likes being fit as much as I do. Some guys play golf, some play softball. I like to go to the gym. Now, just to be clear, I do not exercise. I work out. I like to pump iron and get my blood pressure up and get my heart rate going. So that's kind of us in a little nutshell there.
Thank you for that. Thank you for telling us about yourself. Let's talk a little bit about your journey with Parkinson's. What led up to the diagnosis?
Well, unfortunately, I've always been somebody who likes to be active and work out. That made it a little easier when I was diagnosed with Parkinson's. And I say a little easier because being diagnosed with Parkinson's is not easy. We had only been married about a year when I hit the progressive jackpot of the Parkinson's lottery. So Tana was on board. She was just going to do it with me and see how things went. And we had certain visions for how life was going to be. Our boys were already, my boys and she inherited, were already growing out of the house. So even though we were newlyweds, we had quite an idea how life was going to be, but it quickly changed. She first noticed, or she taught my caveman walk. When I would lean forward and hold my arms stiff and walk everywhere, that's what's the caveman walk, she always say. And then I started getting a little bit of tremor on my right side, and that was kind of how the whole thing started out.
Many times people come up with symptoms that before the diagnosis, they come up with no explanation for. And that's very true of Parkinson's disease. You know, it begins very slowly. By the time you come to the doctor's mind to be going to a doctor or to be evaluated or diagnosed, symptoms have probably been going on for several weeks, months, years even. And there are going to be about 1.2 million individuals with Parkinson's by about 2030. And of course, Parkinson's, as you all know, is when the brain stops producing a chemical called dopamine. Dopamine runs a circuit in the brain. That circuit controls movement, so it promotes movement. So when that dopamine chemical becomes less and less, the brain tries to make up for it. It doesn't make up very well for it, and so folks will have symptoms that will creep in. Walking symptoms, not swinging my arm, I got a pinky that's shaking or a hand that shakes here and there. So all these symptoms will come in that will lead to ultimately you going to a doctor. A doctor might say, okay, I'm not sure what this is, send you to a neurologist, who ultimately makes the diagnosis of Parkinson's. Motor symptoms of Parkinson's are very straightforward. The rigidity, slowness, tremor, typically on one side of the body, but then there could be a non-motor symptoms as well, restlessness in the legs, talking in your sleep, you know, issues along the lines of, you know, difficulty with sense of smell, constipation. These are some of the symptoms that result in being diagnosed with Parkinson's. We call them premotor symptoms and motor symptoms. Many times people with tremor will come to the doctor's notice much earlier because they'll see the tremor, it's visible, this is not right, I need to go get it evaluated. People that have more slowness and stiffness often will blame their symptoms on old age, arthritis, and maybe come to the doctor's attention later. So I've seen people as early as 3-4 months into symptoms come in, people as 2-3 years later. They've had Parkinson's probably for that long before they come to a medical professional's attention. I had a gentleman years ago that told me, you know, I was probably slowing down for about a year or two, and I'd walk from the metro station to my house, which was 2 blocks away. Initially, I just thought it was just getting old. I was tired at the end of the day. I was, you know, I had hit my mid-50s. And people in their early 40s and 30s would walk past me, and I just thought nothing of it. It wasn't until people in their mid-50s started walking past me that I realized, I can no longer blame this on age. Something is affecting me. Came and saw a neurologist who referred him to us. We diagnosed him with Parkinson's. I still see him to this day. It's been about 13 years since his diagnosis, but you can see how symptoms creep up on you in a way. In what ways do these symptoms impact your life? Your caveman walk, amongst other things. Did it prevent you from doing things you enjoyed?
Well, yeah. At first, well, not first, one of the things that was bothered Tan a lot was I had trouble sleeping. So it kept getting worse and worse, and at the height of my worst of it, I probably slept an hour every couple of days. I just was, that was not doing well. I got very short-tempered, or like high anxiety, just watching TV. I'd say, I don't know what the problem is, but I can't watch this TV any longer. It just made me, so anxious that I couldn't hardly deal with it. At the time I was still working. Simple things that I did day to day running the company, I just couldn't handle anymore. It just was too much for me. I went through a phase for 4 or 5 months where I couldn't drive, and that one pretty much was about all I could handle there. I was feeling pretty bad about it. And Tana was starting to get worried because she thought she maybe have to get some outside help so that she could still work because she travels so much.
And it's the impact that many times people will come to the doctor's office for. It's already impacted me in some ways. So we always ask those questions about how it impacts individuals. So what ultimately led you to seek medical help? Things have clearly been going on for some time. Who made the diagnosis, and are you still working with that person?
Well, first off, no, I'm not still working with that person, but we'll get back to that. I was just so stiff most days, I couldn't hardly function. I'd get out of bed and just stretch and move and anything to get going. And Tana thought my tremor was a pinched nerve, so she took me to a physical therapist. He sent me to the MRI. That was a blank, nothing there. I mean, I had a brain, but I mean, it the physical therapist is the first one that thought it might be Parkinson's. He told me, your problem is not from the chin down, your problem is from the chin up. He recommended I see a neurologist, and that was the guy that diagnosed me with Parkinson's, and that was in 2014.
How long had you had symptoms for by that point?
Well, later on when we talked about getting into the medicine, the first time I took medicine was the first time I realized I'd had things for a long time because it changed stuff from, man, if I'd had this 10 years ago, I'd have been pretty good.
Well, that brings you up right. When you were first diagnosed with Parkinson's, tell us a little bit about how that made you feel.
Well, I didn't want to talk about it, really. The day that I was diagnosed, we left the neurologist's office, just went across the street and had lunch, and that was, I didn't want to deal with it. But my wife got on the internet, started checking around, which I do not recommend. It was just so much, it's a black hole of negativity. People saying medicine, you start taking medicine, you have to take more and more and more, it doesn't work after a while. And we didn't want to deal with that, so we were gonna try going down a different path.
Makes sense. I mean, there's information online can be both good and bad. You have to be able to parse out between the two. Tell us a little bit about the medications.
Well, the first neurologist gave me some medication that, it was 2014, so I don't really remember what it is. Maybe if I'm gonna do these talks, I should find out what it was, but he gave me something and said, start taking this, take it for 6 weeks, and then come back and see me. So I took it for 4 weeks and came back and said, this does not work. I don't know what it's supposed to do, but I'm not getting any better. And he said, well, wait a minute, you gotta realize you have a progressive disease. And I said, well, it's progressed more in the last 4 weeks than it did in the 6 months before, because this isn't working. I was pretty frustrated because I didn't feel like I was getting any better or I was getting worse, and I wasn't getting any support from him. And so the first doctor was not right for us, and we didn't like the idea of medication just because of what we read on the internet. So we started going to holistic practice, holistic diet. And we did that, and I say we, with 10 had to shuffle me around, but I did that for 2 years. And what I know now is part of why that didn't work. But they told me that part of why I was so stiff was all the working out I was doing was causing. So they wanted me to stop working out. And so I stopped working out, started taking all their things. And the bottom line was 2 years later, I lost a ton of weight. I was not doing very good. And one day the holistic doctor just said to me, we're not helping you any, are we? They weren't. I was definitely losing ground.
It's a tough situation.
Yeah.
Let's talk a little bit about Parkinson's medications. How does levodopa work? Now, Parkinson's medications can be numerous. There are many Parkinson's medications out there. The mainstay of your Parkinson's regimen becomes levodopa. Sometimes it gets started early, sometimes it gets started a little bit later, but at some point every Parkinson's person goes onto a medication called carbidopa levodopa. It's a two-part medication. The levodopa is the portion that we're concerned with getting into the brain. The carbidopa is designed to allow the medication to get into the brain. Now, this medication gets into the brain, and what it does is this. It gets in and it gets converted to a chemical called dopamine. That was the chemical we talked about a little while ago that is deficient in Parkinson's. So it helps the brain make dopamine when it's not able to make its own. That's exactly how this medication works. Now, interesting thing about this is the medication is designed to be able to go through the gut to get into your system and then get into the brain. So it's a little bit of a journey on how it gets in. And it replaces the dopamine so you have more dopamine around, taking away some of the movement issues that you have with Parkinson's, whether it's rigidity, slowness of movement, or tremor, or a combination of these symptoms. Levodopa works very well. Early phases, individuals are in honeymoon phase. What do I define a honeymoon phase as? You can start a levodopa medication, you start at the lowest dose, it takes away your symptoms, you feel great, things are going great. What does that mean? People will come back to my office and say, look, I take this medication, I don't really feel any symptoms of Parkinson's. Are you sure I have Parkinson's? I said, yes. That's when we started you on the medication. That's why the symptoms have improved. And sometimes people say, well, actually I missed a middle of the day dose and it still felt fine. That's because the brain is in a honeymoon phase. You can store that medication for a long period of time. But as Parkinson's progresses, what happens is the brain needs more and more support from dopamine because it starts to produce less and less over the course of time because that's a progressive disease. So brain needs more doses and the brain's ability to store becomes less. So now what happens is two changes happen. One, it needs less, it makes less. So in other words, it needs more medication to support it and it's not able to store the medication as much. So you need to take it more frequently. So many times I'll tell folks is, you start out with 1 tablet 3 times a day, and I say you kind of go up what I call the levodopa ladder. You go from 1 tablet 3 times a day to 1 tablet 4 times a day to 1.5, 4 times a day, and so on and so forth. We're dosing so that you're getting more medication and more frequently over the course of time, but not so much that it gives you a lot of extra movements, or we try to minimize extra movements as much as possible. So it becomes, in the beginning it's easy, but over the course of time you start getting to this tightrope situation where this is too little and this is too much. You want to get just right, and just right becomes a little bit of a challenge in that sense. That's what we call when we say the window. If you ever hear your doctor talk about, we have to keep you within a window, that's the window. Not too high, not too low. And it becomes narrower over the course of time. The goal is to keep you in that in-between phase. What was on and off like for you?
Well, at first I didn't know what on was. I had been doing the holistic thing, and so they didn't have anything to give you on. But I was still going to a physical therapist because there I got some relief anyway from the different things he had me do. I got back some of the movement I lost, and he could get me limbered up a little bit. But he finally said to me one day, I'm not going to take your money anymore. He said, I did a little research. I found this movement disorder specialist. I'd like you to go see her. She's specialized in people with Parkinson's. She's good. I know you don't think too much of doctors, but give her a try. Just one time, go see her. So I went to see her, and first off, he was right. She's the greatest, and I'm still there today. But she wanted to start me on carbidopa levodopa. And since I hadn't had a good experience with medication once before, I wasn't too thrilled about it, but I was now getting near 2.5 years of messing around, and I felt pretty rough. So I took prescription, I went home because my wife wasn't with me, and I talked to her. I just told her everything. She said she had dispelled all the rumors, the notes I had about what was the problem with taking medication, and how long did it last. And she explained why you had to take more and why you took it in the beginning and everything. And so we decided, let's give it a try. So I started taking the carbidopa levodopa, and right away I knew something was different. I didn't know what, but I just started feeling better. I felt like doing stuff. One day I was getting on the freeway, and it was when I was allowed to drive. It wasn't when I wasn't supposed to drive. I was getting on the freeway, and the sun was in my eyes, and so I reached up and put the visor down, and it scared me so bad I almost went off the road because it had been 2 years I hadn't done anything with my right hand without telling it to pick up the water bottle. I mean, I just reached up and put it down. Well, the next 2-3 days later, I was back down the driveway and I stopped. I knew something was different, but I wasn't sure what. I was looking out the back window. I couldn't turn to look out the back window for a long time because I was so stiff. So it just got better and better. I started feeling like working out again. I went to the gym. I just felt like I was healed actually. But everything was working really good. It probably lasted about a year or so, where I took more, but it didn't matter because I did better. And then I started having a little trouble getting the right amount. I had a timer that went off, and it got to be the timer was every hour I was taking it, and then I would forget. Well, the timer went off. Did I take it? I don't remember, and it's always somebody's duty to keep their eye on me and make sure I took the medication if I was supposed to. And it just got to be hard staying in the on-window. I spent more time thinking about taking medication than thinking about feeling good. And yeah, that's how it got started.
So how many years from the time of diagnosis to you first starting the medication that you started, the carbidopa had symptoms even before that, because that was the time of diagnosis. So you see how far back the time clock has moved. Here's when he started taking medications, 3 years of being diagnosed not taking medication or taking other medications, and then there's symptoms beyond that. And so even then you had a honeymoon period, at least for a short time period.
Yeah, I had almost a year where this stuff's great.
So honeymoon periods can last anywhere from a few months to several years, depending on how you are, how you respond to medication. But as you described, honeymoon periods come to an end. Like any other honeymoon, it's meant to come to an end. And what happens when you have those symptoms is when the medications don't last. Well, that's when off comes in. And you made another great point, which was, I never felt on because I never took medication. And that's true. To feel on is to take medication, because that's how you'll feel on. When the honeymoon goes away and the medication doesn't last is when offs occur. So that's what ons and offs are. Ons are when medications are working well. Offs are when medications are not working well and your Parkinson's symptoms come back. Well, we talked about some of the symptoms of Parkinson's: tremor, rigidity, slowness of movement, difficulty with walking, balance. Those are some of the common symptoms. Some non-motor symptoms are muscle aches, pains, just slowness of thinking. I just can't think as clearly now that my medication's dropping. I have feelings of anxiety, sweating, profuse sweating, feeling like hot flashes. Lots of things occur. They may be different from person to person. Some of you may have the same symptoms over and over again. Others may have never experienced some of these symptoms and may not be sure what they are. But these symptoms do occur, and one of the easiest ways to find out if your medication is on or off is if you feel the medication's off. I call it the get up and go test. I have someone get up from a chair, go across the room, and come back. I have the spouse or the caretaker videotape it, bring it to my office, and then show me what an on looks like. So I can compare. Is that a genuine off? And a get up and go test is very easy. It takes about a minute or two to do. Gives you an idea of whether the medication is working or not. So if you feel like medication is not working, aren't sure, a get up and go test is a pretty easy way to do it. So let's hear from you guys. Clinton and I have been talking back and forth. How does off time impact you guys? Yes?
Well, I try to avoid off time by taking my medicine a little bit early sometimes. Because then I end up going to bed early if I do that. I do take RYTARY on a regular basis. I take 2 with my Ropinerol in the morning, and from Sagilene. I take 2 in the afternoon with Ropinerol and Sagilene. And I'm allowed to take 1 in the morning and evening.
Okay.
And I can start to feel when I need it, you know what I mean? But I find I work on my off times by I teach a dance class at the morning for people with Parkinson's and other movement disorders. By doing that, I'm always dancing and moving and practicing. And I find, I read somewhere that that dance can build dopamine through serotonin release.
We'll talk about that. We'll talk about that.
Okay.
Ask me that question at the end. We'll talk about
I
it.
will. Thanks.
So how else does off time impact you? Does it impact you in the morning, the middle of the day, when you're supposed to be active? Or does it affect you towards the end of the day as you're winding down your day? It can affect you at any point, yes.
I've been noticing about 10:30 in the morning. I get up and go and do things, and then all of a sudden, I think it's time for a nap.
Yep.
And I never.
And sometimes that's not exactly how it feels. I just feel tired. I just can't go on anymore. Folks will say, I feel like my batteries have run out many times. That for no reason I feel, an hour before my next dose, or I took my dose and it was working fine, but then I got tired for no reason and I can't function. Or I was very active and then I went from being very active to dropping very quickly. And I've seen that many times, especially when folks join rocksteady boxing classes or gym exercise, or they start working with intense physical therapy. They'll say, oh, my medications work great, but now, see, this is what happens when you become less active. Medications work well, but they're designed for the time that you're less active, not for when you're more active. So if you look at how does it impact you? Well, it can impact you depending on when it occurs, right? If it affects in the morning, it can affect your ability to get ready, hygiene, getting dressed, being able to have a conversation, being able to go out and have a social event, even being able to walk, participate in exercise classes. Some of the most troublesome issues can be sometimes just general thinking, tiredness, I just slow down, as you mentioned, it just kind of come to an end. And sometimes, as you mentioned, sometimes folks can feel when their need for next dose is coming up. They internally feel they're restless, or they internally feel just that the medication's wearing off. They get that sensation that it's time for their next dose. And it's right. You have to be mindful about taking it. Sometimes you have to set alarms or reminders. And not only does that work on the front end, but then when the reminder goes off, I can tell you that your world has to stop and you have to take your medication. Because if you get the reminder, you shut it off, 15 minutes later you'll be wondering whether you took it or not. And the only way to figure it out is go back to your pill counts and take it. Hopefully you did take it, and hopefully you didn't add more pills in there. But it's one of those things where I tell people, if you hear that alarm, stop what you're doing, go take your medication, and then resume your activity. So it's important to talk to your healthcare professional about off time. Off time can affect your Parkinson's symptoms because the more offs you have, the less ons you have. Plain simple, there's like a light switch, on and off. The more offs you have, the less you're able to do during them. The less productive you are, the less active you are. And if you keep those offs going, they will get more frequent and more severe. If they go untreated, unaddressed, they become more severe. As they become more severe, more bothersome, the less you are doing, the less you're able to do. It becomes a vicious cycle many times. So now that you're having several offs, you let them go, you're doing less. The more they get severe, the less you're able to do, the less you're able to do, and so on and so forth. And it takes you to a tough situation. So when you go to a healthcare professional's office, tell them what's going on. If you have a spouse, a friend, a caregiver, a child, an adult child, or a sibling, bring them with you to the appointment. Have that conversation before. And what are my Parkinson's symptoms like? Have that conversation before you get to the doctor's office so they can have an idea of, you both can have the same idea of what to discuss and what's important. Make a short list, top 1, 2, 3 items. You can have more if there's more issues to discuss, just may not be able to get covered in one visit. And go there with your medication list. Here's how I'm taking my current medications. Many times I tell people, take it 4 times a day these times. Folks come back to me, you know, those times don't work for me. I get up a little later, I stay up a little later. Okay, so what are your times? So everybody's regimen is different, everybody's life is different. What regimen works for you? Fine-tune the medication regimen with your doctor, but also tell them what symptoms you are experiencing, because your healthcare professional can make decisions about whether they need to adjust your dose, fine-tune your dosing, add a dose, or change medications. All that can only happen based on what you're reporting. Parkinson's, in that sense, is a very reporter-friendly disease. In that sense, you have to report in symptoms so that we can see what to do next. The more information, the better information you report, the better decisions we make.
A couple months ago, we had a therapist come. She was talking about how carbidopa and levodopa should be taken at least 30 minutes after you eat protein. I mean, an hour after protein, or 30 minutes before protein.
Hour to 2 hours. The textbook way to take it is 1 hour before a meal, 2 hours after a meal.
Oh.
And so I cannot imagine how somebody would have to wait 2 hours after a meal. Could you imagine if your dose was due in the next half hour, you've all been eating, how you sit and wait 2 hours? So I tell folks, time it in such a way that you either pick, and we'll talk about this as well, pick one. Pick your meal times or pick your medication times. Fix everything around there. You can't have 2 moving parts. So if you pick your medication times, then adjust your meals an hour. It's always easier to adjust a meal an hour later than it is to say, now that I had my meal, I'm going to wait 2 hours on the back end. So it's easier to do it on the front end. If you took your medications before meals, you're almost always going to be on an empty stomach for the most part. So, well, speaking of off times, how did you discuss offs with your doctor?
Well, what I do is I write a list in my phone because I can handwrite, but I don't know about your handwriting, but it's getting pretty bad and getting pretty small. By the time I get to the doctor, I can't read it, so I keep a list in my phone. When I start feeling off, I put a note what day it is, what time of day it is, and then I check for a couple of days. Did I have it the next day? Did I have it the same time the next day? Was it before a meal? Was it after a meal? And I try to just keep a little, I don't do a good 30-day log. I do a few days in a row when I'm feeling it. And if I make the adjustment on my medication, on my medication, and I write down what I changed so that she knows that I took it a little different for a few days, or I've taken it different ever since that day. But that's how I do it. It's just keep a little notes in my phone, and she's kind of picky about making sure you give her your notes when you get there, not when you're done. It gets a little testy if you get all done your doctor's appointment, then you come home with this list of what problems you had over the last 3 months. So you make a list, give it to her when you first get there. not as friendly when you give it to them at the end.
So it's actually important. What you mentioned was keeping a journal. Now, I don't ask anybody to keep a 30-day journal. If you kept a daily journal, I don't think you'd have time to do anything else. I want you to come up with kind of an overview. We made a change in the next few weeks. How did you do? Overall better, overall worse. Sometimes a journal helps, especially if there's multiple moving parts to it. And so I give folks like what I call a homework assignment. Take 3 days of journaling, 4 days of journaling over the next 2 weeks, and send it to us. And sometimes we might do a telephone visit, virtual visit, just to review the journal to say, can we make changes here? Where do we have these? Where's the gaps? To better understand them. Sometimes if it's not a major issue, but it's something that needs to be kept track of, come back in about 4 to 6 weeks. We'll take a look at that. And that appointment literally is to address what's kept in the journal. How can we work with it? How can we fine tune it? But it's important to bring up complaints up front, issues, ongoing things you're there for. Coming to each visit with a goal in mind. At this visit, I would like to get X, Y, or Z done. And there's so many things to accomplish in Parkinson's. You could look at OFFs, you could look at dyskinesias, you could look at balance difficulties, talk about depression, talk about memory, talk about many different other things with Parkinson's. That if somebody doesn't come to us with a priority of here's what I need to address, we'll work on our priorities and we'll say, well, we haven't talked about memory, we haven't talked about mood, we haven't talked about swallowing and speech. Let's do those. Because we haven't done them, we should look at it. And it's fully possible that I may do all of those things, think I've done a great Parkinson's visit, we address all the things we haven't talked about the last 2-3 visits, and you have a whole bunch of other issues that never got addressed. So come to a visit with a list of things, if there is a list of things to talk about. If there isn't, that's fine, because then there's other things that your healthcare professional always has to be able to discuss. And sometimes if we have a set of priorities and you have a set of priorities, guess whose set of priorities wins? Yours. Why? Because you're the one having Parkinson's. You're the one living with this day to day. So what becomes priority for you should take priority. Now, other things can always be done in an additional visit down the line, but if everything is fine, then there's things to discuss. So it's important to have that goal set in mind.
One thing I think is important is to make sure you're making your list the whole time between because I only go in once every 3 months now. And so things if I wait till the day before, the week before, and well, how have I been feeling? It just doesn't work because I always leave and there's one more thing that I want to tell her, shoot. But if I make the list while I'm going for the whole 3 months, I just jot the date down, what the feeling or thought was, then I always seem to get everything handled.
So tell me about the first conversation you had with your healthcare provider about RYTARY. Had you heard about RYTARY prior to that conversation? And if so, what had you heard?
I had not heard about it, but in 2017, my doctor told me we could do something to manage my motor symptoms in my on time, give me a little more on time. When we talked about RYTARY, she talked about the potential benefits and potential side effects, and I made sure that I looked into all that, watched the videos and whatever. But I wasn't really thrilled about trying new medications since I'd only done 2 ever. The first one it didn't work, and the second one I did good for a long time, but then I started having trouble keeping track of it. I just wasn't sure if I wanted to try another medication to get in the mix and have. I didn't want to have any more issues than I had, but she did say I would get more on time, so I was kind of excited about that. So that was kind of where we got that.
It's interesting because everybody comes to that discussion differently, right? So everybody talks about it, and the most common reason to talk about it is off time or how to improve on time. We'll talk about that information. What were your hopes for taking RYTARY when you first started it? What did you think it would do for you?
Well, I pressed my doctor pretty hard as to what I could expect. The only thing she said was, "You're never going to be like you were before you had Parkinson's, but I can give you some more on time and decrease the off time." And that's pretty much what got me excited, was because on times when I felt like going to the gym, I felt like working out, I just felt like doing things, and so that's what I was looking for on time.
Okay. So let's talk a little bit about RYTARY. So RYTARY, of course, is a prescription medication. It contains a combination of carbidopa-levodopa, and it's used for treatment of Parkinson's. What makes RYTARY different we'll get to. Of course, RYTARY can't be taken with certain medications. such as non-selective MAO inhibitors, which may be used for antidepressant medications, within 2 weeks. But other antidepressants are different. Most of the common ones that you're going to hear about, antidepressants, are not necessarily those. But check with your doctor if you're on any medications. That should not be combined. As a general rule, when you start a medication, always look for and see if there's an interaction between this medication that you're starting and another medication you've already been on. What makes RYTARY unique is the fact that it has a 2-part component to it. Remember we said it's a 2-part medication. The levodopa component has 2 parts to it itself. It has a third of it which comes in immediately, and a 2/3 of it which extends over the course of time. So a regular immediate release levodopa comes in and goes out, leaving you with a gap of off. This medication comes in and lasts longer because the beads are coming into your system over a longer period of time. You're going to get the absorption of the medication into your system over a longer period of time. So this way, what may last immediately only for a few hours here lasts much longer, 4 to even 5 hours. To show you the graph differently, this is immediate release. It comes in very quickly, which is good. But notice by about 2.5 to 3 hours, half of it's gone. What you're dependent on here is the brain's ability to store. Remember we talked about that. Early on in Parkinson's, folks need a little bit of dopaminergic support, but it lasts longer because the brain has the ability to store it, as you mentioned. That's what I call the honeymoon period. I took my medication, it lasted for hours, half a day, and forgot a dose and still lasted all the way through. This is what happens. Over the course of time in Parkinson's, that honeymoon period comes to an end. The brain's ability to store becomes less. So now, if you have the medication in your system, you're on. As the medication starts to go away, you're off. People have tried to extend carbidopa levodopa several different ways. It came out in the mid-70s. In the 80s, they came out with the controlled release. It comes in a little slower, lasting a little bit longer. But half-life of that is about 2.5 hours. Now it's about 3 hours. So it'll give you another additional half an hour or so. So it maybe helps last a little bit longer. In the early 2000s, they came out with a combination drug, a 3-drug combination called carbidopa levodopa entacapone. Some of you may know the trade name Stalevo, or may have heard of it, may have been on it. That medication combination is a 3-drug combination and comes in a little slower, lasts a little bit longer than the controlled release. So people have kind of been salami slicing their way to a more extended release. A little bit more with controlled release, then a little bit more with carbidopa levodopa entacapone, then from immediate release, all of it designed to get around the immediate release issue. Not that it doesn't work, it works, it just doesn't last. It's the problem with medication not lasting. Enter into that RYTARY, and you can see RYTARY comes in quickly, just like it does because of the immediate release component of it. So it gives you the benefit of immediate release, and then it lasts longer because the extended release phase comes in. So you don't have to sacrifice for lasting longer, it has to come in slower because both carbidopa entacapone and controlled release, to last longer, they had to come in slower. And many times people are bothered by that because then the medication doesn't kick in. It never kicked in. I took my regular medication, it kicked in half an hour. This one takes over an hour to kick in. I'm stuck. So it doesn't matter to me that it lasts longer, it doesn't work as quickly on the front end. So that was the biggest complaint. Now with RYTARY, you have a medication that comes in quickly and lasts, so it corrects both ends of the issues. A little bit of safety information. And safety information is very important because safety information applies to people that are taking Parkinson's medications. And always with anything, if you don't know how a medication will affect you, so when you start a medication, don't start it on critical times. I always tell folks start medications on the weekends or lighter days. If I have folks that are still working, actively working every day, I tell them take it on a day that you're off, start it on a weekend to see how it affects you. Never start a medication when you're going on a trip. I've seen anybody who started a medication while going on vacation or a business trip, it's always a disaster because things have changed, your routine is off, and your routine is off on how to take a medication. So very important. And if you have impulse control issues, hallucinations, abnormal thoughts, dyskinesias, lightheadedness, dizziness, please notify your healthcare professional before you start a medication or a new medication range is changed on you, because those problems need to be addressed first. If you're having a problem with already a current medication, don't ask for medication changes until you've discussed those issues. First, have your healthcare professional work through these issues before you make changes. How does RYTARY work? Well, remember I mentioned, since we talked about it, was an extended release. It comes in quickly, like immediate, but lasts longer. In the study, it showed that it gave you twice as much reduction in off time as compared to immediate release carb-levo. By reducing off time by twice as much, it also gave you twice as much increase in on time. overall, you had less offs and increased ons. And exactly the main reason to start RYTARY, as Clint mentioned, is he was talking to his doctor about how it would improve his offs or increase his ons in many ways. And can even improve the ability to have motor improvement. In dose per dose, it was shown that RYTARY gave you about 1.2 hours of on time. What do 2 hours mean? So 1 hour, 60 minutes. 0.2 is probably an additional 10 to 15 minutes after that. So hour and 15 minutes per dose. Why? Because it has a longer acting component to it. That's the simplest reason why it gives you a longer on per dose, is because it's acting over a longer period of time, immediate release. At the same time, not only were people getting longer, they were dosing themselves less frequently. So it's a twofer in some ways. Not only is one dose lasting longer, but because it's lasting longer, you don't need to dose with immediate release as frequently, because RYTARY lasts longer. Again, common things that occur with levodopa: nausea, lightheadedness, dizziness, any of those things that can occur with it, please notify your healthcare professional. RYTARY has the same side effect profile as the other Parkinson's medications, because they all work together in conjunction. So, and of course, we always caution individuals with Parkinson's about depression, because depression is very real in Parkinson's, and untreated depression can result in folks taking desperate measures. I don't think this applies to anybody here, but if anybody's expecting to become pregnant or start nursing, please let your healthcare professional know. We chuckle about it, but every now and then in our center, we have a young lady of childbearing age show up, and we have to have that conversation. About once a year, I have that conversation. I'll be right with you. But we end up having that conversation. But the great majority of the individuals with Parkinson's do not need to worry about that. There are more men with Parkinson's than women with Parkinson's, and of the people with Parkinson's, the average age being the late 50s, 60s, people are out of childbearing age. Yes, sir.
Why more males than females?
Nobody knows.
Oh.
Nobody. People have thought. People have thought for the longest time that there was a hormone component protecting folks. It does not. It has not. Nothing has panned out. We don't know why, but there is. And just to show you, it's more men than women, but you should know the ratio. For every 5 patients, 3 are men, 2 are women. That's the ratio. So it's not like overwhelmingly like 4.5, but 3 to 5. Okay. Let me take your question, then we'll move on back to you.
My question was, how many RYTARYs can someone take in a day?
How many RYTARYs can you take a day? Well, let's talk about it. There's 2 different maxes that you need to be worried about. One is 2450. That's 2,450 milligrams. That is the max dose of levodopa you can take in a day. That would be the equivalent of taking 10 capsules of the highest dose of RYTARY. That's 245. So that's one thing to remember. Second thing is the number of times you can take RYTARY. So there's the max, that's total. The other max is, of course, you can take a total of 5 doses a day. Now you can take more than 1 capsule in that dose, but you can take it up to 5 times a day. So 2450 and 5 times a day. But we'll get more to that in a few slides. How long did it take you to get to the right dose of RYTARY?
Well, she told me in the beginning that it might take a couple of tries to get it right. It did take a couple, but it wasn't too bad. After she gave me the first prescription for it, I think she checked back in about 3 days and just said, "How are you doing?" And we made an adjustment. 3 more days, "How are you doing?" And we got going that way. Currently, I take a dose 3 times a day, and that seems to work well for me. Much like any medication you take, there's possible side effects. So if you have anything, anything wondering about, just check with your doctor and let them know how you're feeling.
It's a process. I think it's important to understand when you convert to RYTARY, it's a process that may require a little bit of fine-tuning. In fact, I set the expectations that fine-tuning is the norm, that expects some fine-tuning in that sense. How did your doctor know you were on the right dose of RYTARY? A lot of folks ask me that.
Well, I'm in a lot better mood when I'm on the right dose. I feel like doing stuff. That's the biggest thing is when I want to do things, I have my dose right, and so I still get some off, but it's a lot less frequent and a lot less drastic when I'm off. But I kind of ease into it. I feel it coming on. I have a couple of things that I know are coming, or I know when the off time is coming. Doesn't matter for the talk, for the sake of this talk, but I can feel my right foot starting to turn, and it gets turned up on its side, and oh no, I'm running out of medicine. So, but the biggest thing is how she knows that I'm on the right one. I I come in, I'm excited, I wanna talk, and tell her how good I'm doing.
And you can see when you do have off, you have telltale signs where the medication is wearing off. Okay. So how do we dose RYTARY? It's very important because we talked about how do you find the right dose, and how do you know you're on the right dose, and why does it require adjustments? Well, there's a simple reason for that. This graph that you see that kind of goes up, the green line goes up and goes down, that's immediate release. That's your 25, 100 immediate release. If you were to dose the same amount in RYTARY, this is what it would look like. Sure, it would last longer, but you really wouldn't feel on. Why? Simple reason, only a third of that drug is coming in immediately. Let's say we give you twice as much. Well, now 2/3 of that is there. A third from one and a third from the other capsule. Sure, it lasts longer, but it doesn't quite get you to that on where you need to go. What you want to be able to do is get to the top of that mountain and stay there. When you get to 3, that's what does it. You have to go up to that dosage, stay there, because it lasts longer. So sometimes getting to that top takes a little while. We convert folks based on a formula, and based on the formula, you could be somewhere in there, and you could be somewhere at that close to that right dose. But then folks might come back and say, you know, that it's still not fully on. Okay, let's adjust the dosage, typically upwards, if we need to get you to that on, so it can last longer. It doesn't do any good to last longer when you don't feel an on. Makes sense? If you're off, you're going to be off because it doesn't last longer. You're off even if it lasts longer, you just never get to that high dose. You want to get to your main dose that turns you on, giving you a full on, and then it lasts longer. As long as it lasts that distance, then you know you're on the right dosage. So, it's important in this process, as is with any process with Parkinson's or your healthcare professional, to talk openly about it. If you look at it, 3/4 of the individuals that were converted to RYTARY needed a dose adjustment. So it's very simple. So when I talk to folks about converting them to RYTARY, I tell them, if I get your dosage perfectly right the first time, congratulations, you're in the minority of the population. Only 1/4 of the individuals will get their dose just right with that conversion, which means the majority of the time I will have to adjust your dose based on what you tell me. Now, how do we get you to tell us how things are going? We start RYTARY on day 1. Within 2 or 3 days, you touch base with either the office, either with our nurse practitioner, or you send a message to the office, or you keep an appointment with the office. Whatever works between you and your healthcare professional. It's called a check-in visit. It's a brief visit just to see how you're doing. Are you having any side effects of the medication? Are you having any problems? Do you feel it's good, or is it not enough? If it's not enough, we can adjust it. If you feel it's too much, we can lower it. And if you feel you're doing well, great. If you still feel well, about a week to 10 days later, we will continue that medication. So it's always a midpoint course correction is what I call it. 3 days out, a couple of days out, and typically when we convert, we always tell you to keep an idea or a log of how you're doing. So it's important to discuss how you're doing, because many times you may need an adjustment, and that's all it is. So folks sometimes will get disappointed that they need an adjustment. It all comes down to setting expectations. What dosages are there? Well, the dosages are very simple. I'm going to read the numbers in blue, because those are the levodopa doses. 95 milligrams, 145, 195, and 245. So when you ask me what the maximum was, it's 10 of those double blue capsules, 245s in a day. That's the maximum dose of RYTARY that can be taken. It's available in 4 strengths for 2 reasons. You see that blue capsule, double blue capsule?
The one at the very end?
All the way on the right?
Yeah.
It's 10 of those is your max dose.
Oh.
So if you take 10 of those, that's the maximum dose, that's 2450. Now if you look at it, RYTARY comes in 4 dose strengths. And the reason it comes in 4 dose strengths is it allows you to be able to fine-tune your dosing. Some people may need a combination of 2 different doses, and some people may just need a combination of 1 dose, 2 capsules. So it allows you to really fine-tune by either taking multiples of 1 dose or mixing and matching doses. So always take RYTARY as instructed. This is the food instructions. And for this reason, it's important to take it 1 to 2 hours here, it says before eating, and about 1 hour before or 2 hours after. And that's an important point, it's right up here. And because RYTARY is a capsule, it has beads inside it. If you ever open a capsule of RYTARY, it has beads inside it. So if you wanted to be able to take the beads, because you can't swallow the capsule, it's recommended you can open the capsule, dump the beads into a spoon of applesauce, not peanut butter, not yogurt, folks, because it has protein and fat in it, into applesauce, and put the spoon of applesauce on your tongue and swallow it. Don't chew on the beads, don't crunch the beads, because then they will lose their benefit. Take a sip of water after you're done swallowing the applesauce, clean out your mouth so all the beads can go in, and you still get the full extended benefit. But don't take part capsules, don't crush the capsules, because you'll damage the beads and they won't work. else can you share about your experience?
There's a number of things that I do to manage my Parkinson's. From working out regularly to staying on top of my medication. I still do physical therapy. A lot of it I do at home, but I still do it. I do speech therapy every day, just trying to, that's not the best today, but to keep my voice and my swallowing good, I do speech therapy. I work with my doctor, because some days my body just says, no, I'm not interested, but I try to press on and keep going to, I want to live my best life. And since Tana is still only been married 9 years, I promised her 30. Of course, that was before I knew I had Parkinson's. So, but I'm still going to stick to it. Asking for help isn't always easy, but sometimes it's necessary, and that's what I do. I have to do maintain my own independence. Tana's good about that. She's a good coach. She's not a cheerleader. She lets me figure out things on my own. But that's one of the things that this whole experience has taught me. I've got a lot of tools in my toolbox, from my doctor to my medication to my workout to support systems. There's a lot of stuff available. Just don't be afraid to ask.
I think that's excellent advice. I think the exercise idea is also incredibly important. There are things that Parkinson's can fix with medications and things that cannot be fixed with medications. Exercise can fix things that medication cannot, vice versa. Let's talk a little bit about living well with Parkinson's. I think that was a great segue to talking about it. Parkinson's is a disease I believe regiments your life. You know, if you have a regimented lifestyle, you do much better than folks that do not have a regimented lifestyle. So in Parkinson's, you need time to be able to exercise in your day. Why? Because you want to maintain muscle mass. You want to be able to maintain conditioning and toning of your body. You want to be able to eat well so that you have good gut health. Why is it important to have good gut health? Parkinson's patients are prone to constipation. Constipation changes the health of your gut. Plus, you're now dependent on your gut to get the medications to your brain. If the gut is working well, the medications get delivered appropriately. If your gut isn't working well, guess what? The medications aren't coming in consistently, and you may be all over the place with medication. So having a healthy diet, high in fruits and vegetables, greens, helps maintain good gut health. That's not to say you can't eat protein and fats. You should. You should eat a balanced diet. You also need time to manage stress, whether those are the negative thoughts that come in, or those are the stresses of life that come in, but being able to manage stress, be able to find time to go to sleep on a regular basis, because your body needs sleep. Sleep is an essential function. And the more we understand about sleep, the more we realize how essential it is to maintaining reasonable health, not just in Parkinson's, but overall health as a human being, because it's essential to have a good amount of rest, not only for your body, but also for your brain. So many times it's important to exercise, rest, eat well, and manage stress, or have a happier, healthier outlook on life.
Those are just things that anybody would tell you are good for life.
They're good
but
for life.
It's 3 times more important than the Parkinson's to make sure. Sometimes I won't be feeling the best. How much water do you have today? I don't know, a glass. But it's important. It's more important when you have Parkinson's to do those things. Stay on top of them.
I had a gentleman send me a message earlier this month, and he said to me, I'm doing much worse with my symptoms. And you automatically something. He said, I've been busy with work, and because I've been busy with work, I have not slept well for the last week. I've only been sleeping 3 to 4 hours. And I resisted the urge to say, well, you already know the answer. Because you already know the answer, what it is. I said, you have to carve out time to be able to sleep. No wonder your tremor is worse. No wonder everything is worse. No wonder you're exhausted. Because if I didn't have even if you didn't have Parkinson's and you slept 4 hours every day for the last week, you'd be exhausted. And as you mentioned, it's doubly or triply worse when you have Parkinson's in that sense. So what did we learn today? We talked about RYTARY. It's a long-acting levodopa. Why is it long-acting? How is it long-acting? We talked about how RYTARY reduces off time because of its unique longer-acting formulation compared to immediate release. We talked about when it's important, when you start to take RYTARY, it's important to communicate with your healthcare professional. And the last thing we learned is important to keep track of your symptoms and communicate with your healthcare professional at all times, so they know where you stand with your symptoms, and you know where they stand in terms of medication, so there's no misunderstanding or incorrect understanding of where things are. It's always important to communicate openly. For those of you who do decide to go on RYTARY at some point, there is something called the RYTARY program. It's basically an access program that looks at RYTARY and your benefits. Mike, I think you're supposed to do this, but I'll take care of it. So it is basically designed to see how best you can get access to RYTARY if you're a healthcare professional and you decide this is an option for you. If you're interested in learning more, I'll do Q&A in 1 second. If you're interested in learning more about it, you can certainly look up the RYTARY website. And of course, there's treatment journals out there if you want to track your off time. And many times I task my patients to track their off time, so I give them a journal. If they decide to do it after the fact, they can find it online, they can track the journal. It's important to track your off times if you're concerned about medications not working. So it all begins with that concern. And then of course, if you're having off times, discuss with your healthcare professional. Discuss it openly. How frequent is it? How often is it occurring? How severe is it? And how does it bother you? 3 very important questions. If you tell your doctor, my medications are not working for me, they will ask you, how many times in a day, how many times in a week? How bothersome is it? And maybe they might ask you another question, which is how close to food or apart from food is it occurring? Last thoughts, and then we'll do questions.
Well, I would say not every day is a good day or a bad day. Some days are just a day, and those are okay too. Today, 10, I don't stress out about too much or plan too far in advance. We just focus on enjoying every day, enjoying our time together. And one thing we look forward to is speaking to people like you and doing groups like this here and around at home. I know giving back is part of what I can do for the community, so thanks for letting me share with you today.
Thank you.
You're very welcome.
Came a long way.
Any questions? Yes.
Can you give us an example of stress management? What's the best thing to do?
It completely depends on your personal. Some people will stress manage by meditation. Some people will stress manage by praying. It completely comes out to what's individual for you. Stress management is one of those tough things because it comes out to your own belief systems. What I suggest folks do is meditate. What I suggest folks, if they're very religious, pray. And pray as in have a conversation with God in that sense. So those are 2 great examples of stress management. Sometimes it's making a list of your priorities and say what really matters. Many times we stress, and I can say this for everybody, including myself, we stress about the small things. And the smaller details, whereas the bigger picture is what needs attention and focus. So many times you look at it and say, oh, you know what, actually I'm stressing about this one presentation, but I'm actually more worried about these other things that I should be concerned about. So stress management sometimes is reorganizing a list of priorities. Sometimes it's talking to your family members. Right? Sometimes we anticipate, the anticipation of something causes more stress than the actual event. I'll give you an example. If you talk to folks that are newly diagnosed, the anticipation of having that conversation either with a spouse, if they were diagnosed alone, or with their children or colleagues is more stressful than it actually is. Many times the colleagues or the children already know what it is because they've looked up their symptoms online and say, oh, I've been waiting for you to tell me that. But the person stressed about it so much that for the week leading up to it, they were stressing out in that sense. Holidays, for example, can cause a lot of stress. A lot of my patients will complain about stress right around the holiday season. We're kind of heading towards the holiday season slowly. But holidays cause a lot of stress. So sometimes you have to kind of look at stress and what is causing stress and be able to manage those issues in your life. Whether that's relationships, friends, family, in that sense. There's no one solution for stress management.
More what I would say, I put up on my refrigerator, breathe. Just take a deep breath into your nose, hold it a little bit, and then through your mouth.
You'd be amazed how much that helps. It kind of gives your whole body and brain a pause for about a minute or so.
Also, if I could take one medication, I take one medicine that I would take. If I could only have one, it would be RYTARY.
Okay.
It's the best. It really is. You feel a big difference when you take it. And that's what I was asking you. I take the 145s.
Mm-hmm.
So I was asking you that because if I take it real early in the morning, if I'm up at 5, and by 9 o'clock at night, I'm like basket case.
course, is maximize it 5 times a day, but here's what I do. For folks that have a longer day, I tell you to start taking it. RYTARY can be taken up to 5 hours. I'm not saying that's what you should do because I'm not your healthcare professional. But this is what I do for folks that are having a longer day. Because some days are shorter, some days are longer. And RYTARY can be typically dosed up to 5 times a day, but 5 hours apart. So if you do 5 times 5, that's over a day, 25 hours. So if somebody's having a longer day, I simply tell them to space it apart a little bit more. Most of my folks with RYTARY will take it about 4 hours apart. But if they're having a longer day and they know up front that they're having a longer day, like today is a long day for me. So instead of taking 7, 11, 3, 7, they might take 7, 12, 5, and 10. See how that stretched out the day a little bit more.
And how's ropinirole work with it?
So ropinirole works differently. So let's talk a little bit about ropinirole. Ropinirole is a dopamine agonist. The way it works is it works on dopamine differently than the way RYTARY does. RYTARY, of course, helps the brain make dopamine. Ropinirole is one of your 3 medications in a class called dopamine agonists, which are not as powerful as the levodopa class. But what it does is it acts like dopamine on the brain. So when the medications are up and down, ropinirole will help smoothen some of those things out. It'll smoothen some. The way I think of ropinirole when added to levodopa is that it smoothens out the gaps that might be left behind. That's how I tend to think of that.
And
Now,
how's recycling? Some people may.
I'm going to give any questions you ask me. They're specific to your healthcare. I'm going to address in general terms of the advice I would give to my patients in general. Now, that's it. Rasagiline works very differently. Rasagiline works to basically recycle the dopamine your body makes. So when you have Parkinson's, of course, as you mentioned, dopamine is a chemical that is becoming less. We give medications that either look like dopamine, ropinirole, medications that help the brain make dopamine, like levodopa or RYTARY, and medications like rasagiline, which are designed to reduce the breakdown of dopamine. By reducing the breakdown of dopamine, you're keeping dopamine around longer so that it can be reused by the brain.
Thank you.
Absolutely.
Any correlation between the amount of sleep you have at night and storage? You really piqued my brain with the storage now.
Right.
Because I think if I get 10 hours of sleep at night, I'm gaining an hour off each end of the spectrum where I'm not taking my medicine.
Correct.
I take it 3 times a day.
This is a difficult question. About half, I could split down the middle. About half of the patients come into my office and say sleep for them is restorative. Because during sleep we know that the body rests, but also the brain doesn't rest, but we actually know the brain is actually very active during sleep. And this was actually a lecture that I heard on sleep. But years ago they used to think that sleep is just the brain just goes to quiet rest and that's the end of it, and so does your body. The brain actually goes through different phases of functioning when you sleep. And some of those functions are rest for the brain, and some of those are regenerative for the brain. About half my Parkinson's patients will come in and I'll ask them how their morning is. You know what they'll say? Morning's the best time. Why? I wake up rested, I feel like I have very little symptoms of Parkinson's, and then I get up, I take my medications, and I make a seamless transition. Some of my patients say, I feel so great in the morning, I don't take my medication. I say, uh-oh, I know what's going to happen next. What happens 1 or 2 hours after you wake up? Oh, I wake up, I'm good, but within a half an hour, I feel the symptoms of Parkinson's come up. Why? Because the sleep was restorative, but the waking days. So they need medication support during the waking day. That's about what half of my patients that say sleep and mornings are the best time. The other half will say sleep is nice, but the morning is a tough time because that first dose doesn't kick in. So many times, I tend to think, generally speaking, in earlier Parkinson's, earlier is kind of a vague term, but earlier Parkinson's, sleep tends to be restorative for many individuals. In later Parkinson's, folks might notice that when they wake up from sleep, that they wake up, and because it's been such a longer gap between the last dose and the next dose, that they're having more symptoms because they've been down for a lot longer.
Because that was the only time I ever felt off, period, was when I was still trying to work, getting up early in the morning and starting my meds at 5 o'clock.
Correct.
And then I'd get to the end of my day and I feel like I wanted to squirm right out of my skin. I didn't know what to do with myself.
You were restless.
Yes.
And that tells you were at the end of your dosing.
But once I retired and I can sleep longer now, I don't have that feeling in the evening anymore.
So if sleep is restorative and you're not waking up off, or you're not waking up stiff, slow, off, then sleep is restorative for you. But for other folks, even if they take a bedtime dose of medication, let's say 10, 11 bedtime to even midnight, By the time you get up, it's been about 7-8 hours. Almost no medication lasts 7-8 hours, let alone 10. And so if you wake up in an off state, then we have to manage those challenges a little differently. But I can tell you, half my patients will say sleep is wonderful, the other half will say sleep is fine, but I wake up wake up in a stuck situation. Any other questions?
Could I
Go for it.
address the
I'm gonna go
stress
grab water while you
question
do
just
that.
a little bit? Sometimes when stress, I think, has a lot to do with the spouse, not giving them stress, but when you present them. Because, for example, today, before I was coming here, my wife called me, she's somewhere else working, and she had some information on a property that we're looking at. And she said, I'll send it over to you. And I'm like, no, don't send me anything, because I'm using all my mental to come here to talk to you. And she was gonna send me over some information about buying property. And I can only deal with so much, I couldn't deal with it. And so, she knows that, she knows when to feed me certain things that I can take and when I can't. All the bills I'm in charge of are on auto pay, because money makes me nuts. I can't deal with money. I always think I'm going broke, and I'm not. It just seems that way. And so she just got everything stuff on auto pay. That eliminates the stress of having to think about paying that every month. And so just feed them what information they need when they need to hear it. They don't have to keep it from them. Just feed it to them as needed.
So open lines of communication and understanding your partner.
Yeah.
I think that's a great idea. Any last call questions? I remember your question. I'll do that.
I feel so spastic. Some days I feel off, and some days I feel on. And I didn't adjust the time I take medicine. That makes sense. And it sounds to me like you're saying that's okay.
It's okay within reason. So I'll tell you, here's my rule around it. No 2 days you're going to have are going to be the same. It doesn't happen in life. You may wake up at 8 o'clock one day and 9 o'clock the other day. You may wake up, you may go to bed at 10 one day and 11 the other day. You may have an active day, a lighter day. No 2 days are going to be the same. There are certain guidelines I like folks to follow with medications. It's what I call in my clinic, it's called dose hygiene or medication hygiene. What are they? Take your medications at a routine. If you wake up at 8 o'clock that morning, take your first dose at 8. You wake up 9, and guess what? You take your dose at 9. What you respect is the interval. Because remember, we talked about storage. So your brain's ability to store medication is the same. So if you start at 8, your next dose is, let's say, 4 hours, then it'll be 12, 4, and so forth. If you start at 9, your next dose is at 1, and then 5, and so on and so forth. Make sense? Which means you have to just adjust. If I wake up at 9, I'm going to take my pill at 9, I'm going to eat my breakfast or my first meal at 10. My next dose is at 1, my second meal can be as early as 2 if you choose to have a second meal. So there's components around that. So one is take your medications with a routine. Routine doesn't mean the same time, but means same time interval. 2, take your medication apart from food that I just mentioned. 3, take your medication with a good amount of water. For 3 reasons. 1, water can help prevent you from getting sluggish. It can prevent your blood pressure from going lower. 2, water ensures that the medication gets down into your stomach, so it can get into where it needs to go faster. 3, most important reason than the other 2 also, water is one of the things that helps your body maintain good bowel health. You need, anybody who's ever had constipation, the first thing is make sure you're drinking enough water and fiber and eating enough fiber so that you can get a good bowel movement and your gut can move. So water helps you get the medication where it needs to go. 2, reduces the risk of lightheadedness. And 3, it allows you to be able to not get issues with regards to your gut. So there's multiple reasons for taking water. It doesn't have to be a huge amount of water, but at least, I would say, at least half a glass of not more. And that automatically gets you about 4 or 5 glasses a day in some ways, depending on your dose regimen plus meals. Many times, and if you're still having offs, and if folks come to me and still say, you know what, my meds are all over the place, then there's some other factor. If you're taking your medications on time, the way you're supposed to, same interval, then we got to look at medication food interactions or something else going on. then that's a good person to keep a journal. Because only a journal will tell me what you can't recall. I'm gonna take your question about dance. I remember. So the question was about dance, and how does dance work?
Yes.
This is a very interesting question because we don't really know exactly how exercise works. There are different theories on why exercise works. Not all of them come from Parkinson's, which is a challenge. We know that exercise works, and if I look at it, when I talk to Parkinson's folks, I talk to them about, there are things medications can help. There's the bucket that medication can help with. There's things that lifestyle management can work, stress management, sleep, eating well. And there's things that exercise, physical therapy can help. And lifestyle also includes being social and engaged. We don't exactly know how exercise helps, but there's a ton of studies about exercise that helps. Whether it's dancing, tai chi, yoga, exercise, treadmill, swimming, there's a variety of studies out there that show exercise helps. Some people used to believe, exercise releases dopamine, which is what you alluded to. That the brain has the ability to release dopamine differently through exercise than it does without exercise. And that's a great example. Some patients will tell you after they exercise, they feel like their Parkinson's symptoms go away or get much better. Others feel the exercise wears them out, but they need a little bit more medication. So does that sound similar to what I talked about sleep? Some people feel sleep is restorative, other people say sleep is great, okay, but now I wake up off because I have a big gap. Exercise is the same thing. We don't exactly know what it is. We know that exercise, for a fact, reduces inflammation both in the body and in the brain. And that does not come from Parkinson's, that actually comes from people with MS, which is why MS patients do exercise and are encouraged to do it because it reduces inflammation. We believe because of Parkinson's, there's also some level of inflammation in the brain of a Parkinson's patient. That may be the second reason why exercise is helpful. And maybe exercise is not helpful in the short term, like you pick up an exercise regimen today, and it looks like it kicks your butt for the next couple of days. That's not helping you in the short term, but stick with it, because over the course of time, people will start benefiting from it. And if I have folks that exercise, and I have folks that do not exercise, the folks that exercise always do better. And nothing proved that more than the beginning of the pandemic. When the pandemic hit in late March or mid-March, right around St. Patrick's Day, and in the first 6-7 months of that pandemic time, when everything was shut down, everybody was apart, there were no meetings, things were on Zoom, the folks that did simply the best were the ones that had an exercise routine established, because they simply transferred that exercise routine to their house. And they continued to exercise with other colleagues of theirs through support groups on Zoom meetings, and the folks that didn't did worse. It was an even split. They all did doctor's visits virtually, they did everything else, but it was an even split between those who exercised and those who did not.
Well, just my 15th year with Parkinson's, and I dance to keeping me going, and other being busy. You know, like I know a lot of people who have Parkinson's who just give up. They go to bed and say, I can't move. I find when I don't exercise, the whole day hurts.
Right.
If I miss a day.
So I'll tell you something similar. When I have newly diagnosed Parkinson's patients, either I'm the first opinion, they know they have Parkinson's because they've looked up their symptoms, they've come directly to a movement disorder specialist, or I'm the second opinion, they've gone to someone else beforehand, maybe that person's a movement disorder specialist or a general neurologist, and I tell them what they have to do to exercise. The first question they ask me many times, because they're in their late 50s or early 60s, should I retire? My answer is no. By now you should know my answer is going to be no. And I tell people don't retire for several reasons. One, it keeps you mentally active. For the last several decades, your job has kept you mentally active. Two, it gives you structure to your day. You have to get out of bed at time X because you have to go to work. Three, it keeps you socially active. So it's physically, mentally, and socially active. Now, maybe you want to retire because it's time to retire. Maybe you don't like your job. Scale down. Change jobs. Even if you decide to retire in such a way that you have a post-retirement plan. Whether that's volunteering, you have to have some level of physical, mental engagement. But many times folks will retire, and even if I tell them that, 3 months later they come and say, guess what, I retired. I remember having this conversation. I said, so what did you retire to? Oh, nothing. And I said, okay, so that whole conversation was a wash. And what happens 3-4 months after that is people are no longer socially engaged, they're no longer as physically active, they're no longer as mentally active. And many times they're complaining about all the things that haven't been fixed, and now the sleep-wake cycle has degenerated, so they're going to bed at 1 o'clock, which is an absolute no-no, and they're getting up at 10 o'clock, 11 o'clock in the morning. And even if you get the same amount of sleep, 11 to 9, 11 to 8, 10, it's not the same somehow. Because now they're missing large chunks of the morning social activities and physical activities. And they're staying up late, while guess what? Everybody else they know is sleeping. So now they're isolated more than you can imagine, because they're not having communication here with people at nighttime, and they're not having communication in the morning. Even though they get the requisite amount of sleep, they don't somehow do well. Thank you very much for your time.
Thank you, Doc.
Thank you.
Take care, folks.
Hey, if you guys don't mind, I do have an evaluation form, there are pens here. If you don't mind filling one out, just letting us know how you feel, whether it be good or bad. And if you are interested in RYTARY, I did leave some, patient education materials laying around on the table.
Thank you, Dr. Baloo,
Thank you.
Mike, and Clint. Good
Thank you all
job.
very much.
Very good job. Before everybody leaves, Denise wants me to bring this up. She talked to John Cullen, who created the documentary, It's Just Parkinson's. And he is going to he gave us permission to show the film, and he's also going to talk to us via satellite and have, answer questions that we might have. Denise's question is, do you want to do this movie in September and October, where we already have planned meetings and planned presentations? Or do we want to do it in November, where we have an open discussion? In November, it would have to be the 3rd Thursday, because Thanksgiving is the 4th Thursday. So would you rather do 2 meetings in September or October, or just do the video, the movie, and John Cullen in November? She wants to know your opinion. Anybody have any preference? I kind of think November would be good, because it's tough getting everybody together twice a month, is what my opinion is. What's the sense? You agree? Okay, November the 17th, and they'll be sending a card out, and we'll do the video IJP. It's Just Parkinson's. It's a story about John Cullen and his struggles and how he handled his Parkinson's. Another thing I want to tell you is Grace handed out the step forward. The group that's going from our organization is called the Indiana Road Warriors. So under donation, if you want to put the team name, it's Indiana Road Warriors. Denise and I are going. I don't know if anybody else, did you sign up?
Yes, David and I are going.
Are you? Okay.
And our family. We're the Caves Crews.
Okay. Okay. What is it?
Caves Crew.
Caves Crew. So if you want to donate, you can donate to the Caves Crew or the Indiana Road Warriors. And like she said, if you want to go, you want to sign up, get in touch with Denise. So that's all I have from Denise. She was out today because she has an abscess and had to go to a dentist appointment. So she feels bad about missing, and I recorded this, or her son recorded this for her. Hi, Denise. Hopefully.